How do you select a health plan? Hi, I'm Kevin Knaus with InsureMeKevin.com, and depending on where you live in California, you may be offered many different plans in your area. In some parts of California, maybe only one or two. But you still have to make a selection, and it can be overwhelming. So what I advocate is using a filtering system, and you filter out those plans that don't meet your criteria. So for instance, the first filter are your doctors and hospitals. Which health plans have your doctors and hospitals in network? Now you can use the Covered California shop and compare tool, which is actually very good. Even if you're not enrolling in a plan through Covered California, you can still use it. It is also good to go to the health plan's website to check on network status. You can also call the doctor's office. Sometimes they have the right information, sometimes they don't. When you go to the website for the carrier, you just want to pay very close attention that you are putting in the correct type of plan that you're doing a search for, because some doctors may be in an individual and family plan and not in a small group, or they're in a large group but they're not in an individual and family plan, so you need to make sure you have the correct network. But let's say you have gone through and you've done that research, or you're working with an agent that has done it for you, and you know which plans include your doctors and hospitals, or most of them. Sometimes you can't get all of the doctors and hospitals you want in a plan. Sometimes it doesn't always work. So you can set those other health plans aside. You don't need to focus on them. Next filter would be prescription medications. Do the health plans that you're considering cover your prescription medications? Now, most health plans, they have a large drug formulary and are going to be covering most of the generics. Brand names, some will be covered, some may not be covered, so you need to be careful on that. And then sometimes some drugs will be in different drug tiers. One health plan may have a particular brand name drug in tier 2, and another health plan will have it in tier 3. Well, if it's in tier 3, it's going to cost you more. So that might be one of the factors. But if they cover your drugs, they have your doctors, then that's what you're focused on. The next filter would be the plan type. HMO, EPO, or PPO. HMO, health maintenance organizations. You need a primary care physician. You need to specify one, and then that primary care physician will be your gatekeeper to referrals to specialists ordering tests. They're kind of your go-to doctor person. If you go out of the network with an HMO, they're not going to cover a dime of it. So you need to absolutely stay in the network to have anything covered at all. The next type of plan are EPOs, exclusive provider organizations. With an EPO, you can pretty much go see any doctor you would like. Call and make an appointment. Some doctors still need a referral for real specialist stuff, but if you need to see a dermatologist or a podiatrist, you can call and make an appointment. As long as that doctor is in the network for the health plan, you will pay the co-payment associated with that doctor, whether it's a primary office care visit or a specialist. However, if you go out of network with an EPO, they will not cover anything. Just like the HMO, there is no out-of-network coverage. PPO plans, overrated to a certain extent. PPOs, you can go and see any doctor in the network. You can go out of network and potentially get some coverage for those costs, but you have to meet an out-of-network deductible first. And that's a minimum of usually $5,000 and usually higher. Once you've met that out-of-network deductible, then they'll usually cover half the expenses of the allowable amount. And there is an out-of-network maximum amount as well. But it's unless you really know something big is going to be happening, you don't even want to go out of network. There's just not a lot of coverage there. All of the plans have a annual maximum out-of-pocket amount. That means that once you hit a particular number, on the high side it's $8,200 for a bronze plan. Once you hit that amount as your patient responsibility, the health plan covers everything for the rest of the year. And to a certain extent, that is kind of the core of health insurance. Like any insurance, auto, home, flood, it's about liability and limiting your liability to high healthcare costs, catastrophic amounts. So you are protecting your assets. So all of the plans are going to do that. They're all going to have a maximum out of pocket. It just depends how high. So then once you know that the bronze plan has a maximum out of pocket of $8,200, and it has your doctors, and you don't really go to the doctor very often, you have no healthcare challenges, maybe a bronze plan is right for you. And there may be some different HMO products that have your doctors or PPOs, and you maybe just going to go for the least expensive. That's perfectly okay. You know, the main thing is that you're buying that $8,200 of liability. Now, when I said out of network, all of the health plans will cover you if you are admitted to an emergency room for a life-threatening condition in any state in the United States. So if you're skiing in Vermont and you have to go to the emergency room, you're going to be covered. That emergency room facility is considered in network at that particular time because your life is being threatened. So you know you're going to be good there. Then the final filter is kind of, bronze, silver, gold, platinum. And my guidance for people that have prescription medications on a regular basis and maybe some brand names is you got to look at nothing less than a silver, because the silver, gold, and platinum plans have prescription drug coverage with set co-payments for the particular drug tiers, whereas the bronze plan doesn't. And even though you're paying more for the silver plan, those set co-payments for the tier 2, 3, and 4 drugs may be a savings greater than the cost differential between the bronze and the silver plan. But that's you're going to have to get into the, get a piece of paper and start working on the numbers. But that's how I generally approach selecting a health plan with my clients, is going through the filtering approach, because as we go through, some of the plans are just taken off the table and we don't have to focus on them. Then we can get down to the nitty-gritty basics of the benefits and how the plan works and what's going to maximize their premium dollars in the health plan. So if you have any questions or comments, you may leave them down below. You can go to my website, get my contact information, drop me a line, and I'll try and answer all of those questions. So I'm Kevin Knaus for InsureMeKevin.com.